Hey guys, welcome back. Are you a chief resident now or fifth year? What's your title? We have Justin Middleton with us today from Boston, Massachusetts, USA.
Yeah, I wish I was a chief, but I am a
Yeah.
fifth year
Okay.
resident at Boston University / Boston Medical Center.
Yeah.
Happy to be here. Thanks for having me.
Yeah. Welcome. Welcome. Thanks for coming on. I feel like we've been connected through socials through Instagram, probably 4 or 5 years almost. I don't know. Because I started Instagram like 2020 after the pandemic started.
I've been in Boston since 2017. I did dental school at BU, did the combined oral surgery med school program at BU, and then my brother Jordan tagged along in 2019, and he's here as well.
So you have a brother who went to dental school, and then we'll get into that a little bit too, but I'm just thinking like the timeline here. You're older.
Yeah, I'm 2 years older.
Okay.
So I got to experience everything first, kind of blaze a little bit of a trail for him. And he's done his own thing, went to Harvard and for co-residence.
Where'd you guys grow up? Is it Massachusetts?
No, we're from a small town called Auburn in central New York. It's about
Okay.
20 miles west of Syracuse.
All right. So you grew up there, and then did you know like right away, like growing up in high school, even you want to go dental school?
I did. So my mom has managed a small oral surgery practice since I was born. My parents are from Long Island, and they made their way, long story, to Auburn. And my mom's first job was this office manager at an oral surgery practice. And her bosses became like second parents, and they were a pretty good influence on both myself and my brother. And pretty much from middle school, I was like, I want to be an oral surgeon.
Did you shadow them like at
I
all?
did.
So what were they doing in the office? Like a dental alveolar? Like what was happening there?
Yeah. Bread and butter,
Yeah.
a
Yeah.
dental
Yeah.
alveolar, wisdom teeth, implants, orthodontic exposures.
You were doing this in high school or college? Shadowing.
Late high school, and then over the summers in college, I was like an assistant. So, I suctioned while they were working. I did the help with the turnovers, sterilized instruments. Yeah, got my hands wet pretty early.
That's awesome. So you went to college at at BU, right? Boston
No,
College.
no. So I went to university at Albany
Okay.
for college.
Yeah.
Finished college there, and then made my way to Boston for dental school in 2017.
Why Boston?
I fell in love with the place as soon as I got there. I remember the day vividly. One of my friends and we had a friend at Boston College, and, I had my interview scheduled, and we drove up at the crack of dawn, probably left Albany at around 2 a.m. To get to Boston on time for my interview. And it was beginning of October. And if you've ever been to Boston in the fall time, it's beautiful. The trees are changing colors, and as soon as I pulled up to the city, I just fell in love. I was like, this is where I want to be. And
That's awesome.
I was
Yeah, I
lucky
went to
enough to be
Boston
there.
for dental school too. I went to Tufts
Oh, heck yeah.
for dental school, and all the way from Seattle. Like I moved all the way there just to go to dental school. Like it was so fun. I loved it there.
Yeah, it's a good city. It's a
Yeah,
young city. There's lots to do.
yeah, a lot of schools in Boston. Just
Totally.
law schools everywhere. Like every 3 blocks, there's like a law school. I feel like
Yes. Yeah.
funny. It's funny. Yeah. So you knew in high school, college, you're thinking dental school, and
Yep.
that's like me. I always thought dental school. And did you? And well, you were thinking actually oral surgery
hmm
at that point.
Yeah,
So you
totally.
kind of knew like what your path was going to be. And so how did it get like when you got into dental school, like how did that process go for you? Pretty easy?
I wouldn't say easy, but I had good roommates. So I lived with 4 other people, and 2 of them, they did oral surgery as well. So we were kind of all on the same kind of bandwidth. My roommates were great. I chat with them still to this day, multiple times a week. 2 of them are doing oral surgery in Pittsburgh, and we were just kind of on the same wavelength. We were respectful of our time, their time. It was just a good vibe. So yeah, it wasn't easy, but I think
Yeah.
the people that I was surrounded by made it easier.
How big is a dental school class over there?
I think there's 115-ish
That's good
for
size.
the DMD class, but we also have about
IS.
80 plus of the international students.
80 total.
Around
Because they
80
do
total.
like what a 2-year track, I think, if you're IS.
Exactly.
Yeah, yeah. That's
Yeah,
pretty
so
good
it's pretty
size.
big.
Tufts is big too, but Tufts
Yeah.
is one of the biggest probably.
Yeah.
like 180 maybe. I don't even know what it is now. 200, who
Yeah,
knows, per class
probably.
with IS. But yeah, so that's awesome. So you had a little good setup there. Are your friends at Pitt or AGH?
Yeah, they're at Pitt.
Yeah, yeah. Nice, nice. I did my
Yeah.
residency at AGH in Pittsburgh.
Okay,
So I
cool.
was there for 6 years after Boston. And back then in the early 2000s, when I was there, like way back then, it felt like a time warp going to Pittsburgh. You go from a cosmopolitan city to, Pittsburgh, it's great for training. I'm not going to say it wasn't
Sure.
great for training. It's just a whole different vibe than,
Totally.
Boston. So yeah, I did my 6 years and I was like, I'm done. Like went back to Seattle.
For sure.
But it was good for training for sure. Yeah. So you did that, and then because you guys had to go through the CBSC and all that stuff, right?
Correct.
Did you do any externships in dental school, like to look around and visit some programs?
It's a good question. So I consider it lucky. I was the kind of COVID years. So I got to bypass all of the externships. I
Interesting.
did one little externship at BMC since I was there over a
Yeah.
Christmas holiday, but I didn't have to do any. I didn't really want to do any just because like I knew what oral surgery was. I knew what I was getting myself into. And I just didn't have the money to go, spend a week or two at,
X, Y, and Z.
across X place. Exactly.
Yeah.
So yeah, I didn't do any.
Yeah. So what year in dental school were you when the pandemic hit, like 2020?
It was when it really affected us. It was the fall of my third year, I believe.
So you're
into
just
like
starting
the
to see
winter.
patients then, and then like
Exactly.
you probably had no patients.
Exactly.
How'd that even work? What you guys have to do, like mannequin stuff again?
We did mannequin stuff. They kind
Oh
of,
man.
changed the requirements that we had to do. They helped us out, but we still had to do a decent amount of work.
I can't imagine like going through dental school when you're so patient heavy your third and fourth year. Like that's all you're pretty much doing a lot of times is booking your own patients, and
Yep.
you got to get so many root canals, so many crowns, so many RPDs and blah, blah, blah. And having like no patients, like during COVID, like we were only for at least 2 months, we could only see emergencies in our office. Like that was the state rule at the time. And, if you had pain or something, we could treat you, but we technically couldn't do like elective work,
Sure.
and that's how Washington State was. And so like, I can't even imagine if you're in school, how long that took to even get, and we were wearing like full respirators. I remember we have pictures of us wearing respirators at work, doing extractions with a mask on top of the respirator because you're breathing in and out, and you have to keep it clean somewhat between patients too. Like it was just hot. It was uncomfortable. I had a respirator with loops on over it and a light. Like it was a lot of stuff on your head. It was like too much. But yeah, you guys didn't see a ton of patients then, like for a while.
Agreed. It wasn't many, but BU did a pretty good job at kind of getting us up and running. I can't remember the exact timeline, but we were up and running pretty quick. And I think we were up running quicker than like HSDM and Tufts.
Nice.
Yeah, we had adequate PPE, and I was surprised that patients were still coming in. I think that's part of, the patient population that dental schools serve. I think they really do need to come in. So I was grateful that we were able to be up and running pretty quickly.
I know Boston's crazy. Like 3 big dental schools in one little area. I mean, most places can't manage that. There's not enough patients and things like that. How many level 1 trauma centers in Boston? Is it just 2?
I think it's 2.
You guys and Mass General?
Mass General, and then I guess Mass General and Brigham. I think they're combined now, or I think they're on the process of combining.
Okay.
Is Tufts a level 1?
I don't think Tufts is level 1.
Okay.
I don't know. I don't know.
Yeah, I'm not sure about Tufts, but I know BMC, Mass Gen / Brigham are level 1.
Yeah. So you guys get your fair share of trauma.
Totally.
You guys did. I remember when I was at Tufts for undergrad, the oral surgery program at that time was combined with, BU.
BU and Tufts, yep.
Yeah, they were combined. And so we would have a BU resident. He was the chief resident of BU at the time was helping out in the dental clinic. They had a rotation that they would help the students. And I was a student back then, and it was Pushkar. Isn't he like your chief now, or like?
Yeah, he's the chairman.
So he was. Let me tell you this. He was either a chief resident then or a third level resident. at the
Uh-huh.
time. And he was, when we were doing as third years or second years, we were doing our injections for the
Yep.
first time on each other. Like that's how they
Yeah.
practice, right? We were doing the palatals and the blocks on each other, our own class. And like he was the resident overseeing that for us. And like there was nobody else. There's no other doctors there. It was just the
Yeah.
resident. And it was him. And like I remember like one of my classmates was watching another classmate do a palatal block or palatal injections on another classmate. And the guy just watching from a standing position passed out on the floor. And then we were like, whoa, and like everyone's like, get push cart. And then like nobody knew what to do. And like, we're all just students, whatever. And like someone grabbed some push cart and like, no, push car. And like they called him over. He came over like, supine, oxygen, feet up, whatever, did whatever, for a couple episode. It was so funny. I'm like, I remember that. Like it wasn't funny that he fell, but he didn't get hurt. But after the fact, it was just thinking about the whole scenario there. Like that was pretty funny. But yeah, that was him. He did that.
That is.
You may not even remember that, but I do.
Oh, I'm gonna talk to him about it. I'm gonna see if he remembers.
You may not, because it's just like a little blip, in your cycle of stuff that you see in residency and stuff.
Totally.
But I thought that was pretty funny, and I remember that. But yeah, that's awesome. So you guys see a ton of trauma, and the Tufts residents at the time, they did their trauma at BU because Tufts didn't have a lot of trauma.
Sure.
And so that's kind of how they did it at the time.
Yeah.
But then now they separated, obviously.
Yeah, they're separate now.
I've been performing full arch dental implant surgery since 2012. I started back then with Nobel implants, and I continue to use them today. Getting consistent results over time and seeing these restorations in function over that length of time has basically strengthened my use of the product. There's over 100 implant systems out there. I just choose the one that's been the most consistent for me. Yeah. So you're back on service?
Yeah, officially, I have vacation this week, so I'm off until this upcoming Sunday, and I'll be fully back on service. I just finished general surgery.
How many months is that?
So we did 10 months of general surgery and 5 months of anesthesia.
Nice. The minimum is 4, right? Still for 4 months. You guys did an extra month.
I'm sorry, can you repeat that?
The minimum for anesthesia for the requirements is at 4 months still, I think.
I'm not sure. I thought it was 5.
Okay, maybe they switched it. Maybe it's 5.
Two pediatric, and then I thought it was 3. It could be anything.
Okay, and so on your anesthesia rotation, are you intubating and doing all that stuff too?
Yeah. The pediatric part of the rotation, that was the more robust anesthesia component. There's a facility, Franciscan Children's Hospital here in Boston, and it's the hospital, or the ORs are just pediatric dental cases. So it's like very robust, like turnover is pretty quick. It's almost like a surgery center. So we would do 6 cases a day. So you've got a lot of repetitions.
On little kids?
On little kids, yeah.
That's good for you guys. It's a really good experience.
Totally. And pretty much all the kids were fairly healthy. So it was pretty good.
Yeah. And then in the hospital, you're doing adults and other things. And are you running your own rooms, or usually they're with somebody?
So at BMC, we were usually with someone. Some of my co-residents, if they had an attending that day that was a little bit less conservative, they would, step out of the room or whatnot. But at Franciscan Children's, like, we were running the show, which was really nice.
That's awesome. That's a really good experience. And you must be happy to be done with general surgery.
Yeah, very, very happy.
We did 16 months in my program of general surgery.
16. Oh my goodness.
And then 4 months of anesthesia on top of that. Pennsylvania was a 2-year state, and so is Washington State. So to get your MD license, you need 2 years of postgraduate, residency. And so we did 16 plus the 4 anesthesia, and they gave us credit for 2 years. That's how you could get for Pennsylvania. And then I also applied to where I'm at now, Washington State. But I think most states are still 1 year. If you do a 1 year PGY1 somewhere, you should be able to get your medical license. I'm like, you go through medical school and stuff, you want to at least have the credential. Like if you don't, get your license, you can't even say it in our state. Mm-hmm. So there's a lot of little rules on that, but that's cool. So how much oral surgery have you done then? Like, with your program being 6 years, like how much are you actually doing? How much did you do up until now?
Essentially, I did about a year, just less than a year, my oral surgery intern year. A lot of it consisted of like ambulatory clinics, holding our pager. So, traumas come in or infections come in, we're the first line defense for, our patients. And then, I bring it up the chain if needed.
Do you have any fun during all this stuff? Like, do you do anything for fun?
Outside of work?
Yeah.
Oh, yeah. So right now I'm training for a marathon, running Philadelphia.
Really? Nice.
Yeah, Philadelphia Marathon in November. I ran throughout college, kind of lost track of it during the dental school years. But during general surgery, I was like, man, I need some like wins each day. So I was like, okay, I'll pick up some running again.
Yeah.
Both of my brothers are in Boston, so I hang out with them. I live with my youngest brother, and then my brother, who's my co-resident, lives right next door. And then just catch some sports games here and there and just kind
Yeah.
of kick it.
What's your program like? So do you get into your program and then all of a sudden you're PGY1, or do you go to med school first? Like, how do you guys do it?
Yeah, so we come in and we do med school first. It's about 28 months ish of med school, and then you kind of transition right to your PGY 1 year. And as mentioned, it's a lot of just like triaging, ambulatory clinics. Then we go off to gen surge / anesthesia. And then when we come back on service as seniors and chiefs, it's essentially like apprenticeship based. You know, we are matched with an attending each month, and, you know, we're their right-hand person. So, you know, we're in their clinics on their clinic days, seeing their patients. And then if they're in the operating room, you know, we're their first assist. 2 of the rotations are the VA and then our dental school clinics. So where we do
So you're
sedation.
first assisting as an intern?
No, that's
Oh,
as
okay.
a senior and
Okay.
the third year and a chief.
Got it.
But yeah, I'm looking forward to getting back and being that first assist now and kind of learning the trade now.
So what do you do for studying? Like, what have been your go-tos, like even in dental school? Like, how did you study? I
So
find it interesting now because
yeah,
there's, when I was in your situation, there wasn't a lot of these options for online stuff, and other things were a little limited. But what have you been doing?
yeah. So what I've been doing now is the app service AROMs. I go through that pretty much regularly.
Mm-hmm.
I see something, I kind of look it up on AROMs and then kind of go through the PowerPoint that they have. I like reading papers. So we have like a drive through our program. It just has tons of historic papers. And I use this service
I
called,
think
it's
AROMS
like,
has historic papers too now. I just did
oh, do they?
yeah. I just did an episode, with them, and they have all the landmark papers in there too now.
Okay. I have to check that out. I haven't seen that.
Yeah.
But yeah, I like using text to speech like services. So like on my phone, you can just upload a PDF and you can just follow along. So that's kind of what I do. I'm not a huge textbook person.
Yeah.
They're just super long. So I try to stick to things that are kind of fairly quick and easy.
What about like Anki or other things like that?
I tried it. I'm not
Wasn't
sold
for
on
you?
it.
Was it for you?
It's not for me. Yeah, I've tried it. It's just not for me.
Yeah.
What
So
about you? What did you do to study?
because I'm in private practice now and I've been
Yeah.
out for a while. The last time I really had to study was the first time I had to recertify my boards. Like, so when you get your boards, when you graduate and you do your orals and you're written and you're board certified, after that, before they changed it, you had to recertify in 10 years. That
Sure.
was what it used to be. And so I did my first recertification, my 10-year out one, and I studied for that again. And so I used some online stuff. There's some PDFs. There were some PDFs people had of courses they've taken. So I, like those review courses.
Yeah.
And so like I got a bunch of those PDFs, and like I just went through those and did pretty well that way. But there's so much out there now. Now for recertification, you don't have to take that exam anymore. They've changed it. You just maintain your CE requirements and you do additional CE, and you can just keep recertifying that way now. But back then they had to recertify. This is not even back then. It's like 5 years ago they stopped.
Yeah.
So it's pretty recent, but that was the last time I really had to cram. Now, if I'm at like an hour-long CE lecture over dinner somewhere, like it's hard for me to like sit there and listen and take notes. Like, it's hard. I'm like, it's too much. It's like way too much. But yeah, so that's the basic, what I've been doing. And to be honest, like clinically, because I take videos and pictures a lot of my stuff, like it helps me even like go back and like review cases. Like you go back and find photos of it. That's why I think taking pictures of things is so important when you're out, because in your mind's eye, you review a case and you're like, you almost think it was probably better than it maybe turned out in a way. And so, but if you look at the pictures, a lot of times you'll see some stuff. Oh, I could have changed this there. I could have done this a little bit differently. And you're always kind of critically thinking. And I think that helps like make you better. And so I think when you're out, get used to taking photos and or videos of things. And then that way, I think it just solidifies what you're doing. And when you go back and edit those things and look at them again and again, it just becomes like muscle memory. It's like it's mind muscle memory. That's how I feel about it. I think it's really helped me. Even just the stuff I put out for people, But the fact that I'm doing it myself also helps me in a way. I don't know
Absolutely.
if
Now
that
I
makes
have a question
sense.
for you.
Yeah, yeah.
How do you record your procedures? Because I've noticed from your procedures, like you have a very nice vantage point of,
How do you
the
think?
surgery.
How do you
Do you
think?
have the glasses, like
It,
the meta glasses?
I know, not yet. I haven't tried those for that. I don't know if it would work, but I have a head camera, so all the
Ah,
recording is me, and all the editing is me. Like I just do everything. There's no one helping me. There's no one recording, uh, for me. Like some people, they have people that hold the phone or something and then record.
yeah,
The problem with that is like when it's really in there and you can get a clear image, it's really better quality. But the problem with that is the angle of it is hard
exactly.
because your hand's going to be in the way in a lot of cases to like see what. So the viewpoint is tough, but the clarity is better that way because my camera is only 1080p. It's limited, but
Sure.
the perspective is almost as close as what I'm seeing. And so
Yeah,
I feel that helps because like when you're doing your procedure, it's nice to like, see from that same angle. Like I feel like that helps. That's why I
totally.
make sure I crop it and rotate it to kind of like make so it makes sense when people view it. Like if I'm doing a maxillary procedure, like I rotate the image for people. I don't leave it upside down. I feel like it's just easier that way for people to get that information.
Totally. I
Less
mean,
work for them to do.
yes. Yeah, no, I try to absorb the information that you put out there. I think it's
I mean, it's just bread and
very
butter
beneficial.
stuff that way, but it's easy for me to record that. Like before I had the camera, I was like taking photos, but it's hard to like do a procedure and the anesthesia and like take your gloves off, get them all ready, get the blood out of the picture, take a good photo or two, and then get gloved up and start again. Like, and then there's another part of the procedure you want to show the membrane tucked in or
Hmm.
whatever it is. And you got to re-glove and take your gloves off, take a picture. I'm like, that sucked. I'm like, I don't know how people do that all the time,
Exactly.
and like they get great pictures. Don't get me wrong, but it's a lot of work. Like I don't want to spend like 3 hours on a case that would, should take 30, 40 minutes. So that's why the video helps. It's just like a dash cam. Like if you feel like it's
Yeah.
on, maybe you'll catch something cool. Most of the time you don't. You just delete it.
Yep.
That's how I feel about it.
No, I think it's great. I think it's
Yeah.
great.
Oh, that's awesome. But so what's like the longest procedure you've seen? Like general surgery versus oral surgery, like whatever. Like what's the longest case you've been a part of?
Definitely my experience is the free flaps.
Okay.
We've had a couple that have been near 24 hours.
Holy crap.
So our head and neck attendings, they're pretty young. So like my intern year, I would say they were maybe less than five. I would definitely less than 5 years out in practice. I would say even less than that. So they were, kind of learning the trade. So they took a little bit longer, but it's crazy because seeing them now, there's no way that they're taking that long. Like,
That's awesome.
they're out, sometimes 8 o'clock at night, 10 o'clock at night. Whereas other times when I was an intern, it was like 4 a.m. sometimes like that.
And are you
So,
guys helping on those cases or do they have fellows?
so we don't have fellows. So we had a fellow. We have a fellowship and we had one fellow, but the program decided not to move forward with taking on fellows anymore. So essentially we have two head and neck attendings. And how it works now is you have a senior resident and an intern on oncology for a month. So one goes with one attending, one goes with the next. So like when you're doing like a say fibula, one of the residents is down at the leg with one attending, and then the other is at the head doing the
That
ablation.
speeds it up when you're doing them simultaneously. Otherwise, you're
Totally.
there forever.
Exactly.
Yeah.
Yeah.
That's awesome. I know that you guys get that experience. Are you guys as attending OMFS then?
I'm
Or the
sorry. Oh,
ENT?
yes.
Yeah.
Yeah, they're
Okay. Okay.
OMFS.
Okay. Yeah, that's great to get that experience in residency when you guys don't have fellows. You guys are basically the fellow at that point.
Exactly. Yeah. From, what the previous chiefs and seniors have said, the oncology block, it is the toughest. It's the most robust, I think, service with just tons of patients in clinic. And then, the physical burden of, being in the operating room all the time.
How's the
It's tough.
politics with that? I feel like it's better than it used to be. Because when I was in training, like ENT would kind of hog some of that stuff, and plastics would hog the recon part.
Hmm.
But now people are getting trained to do the ablation and the flap.
Yeah.
So how's that working out?
I haven't really seen or heard of any, beef between the departments. We don't really have our plastics department doesn't have any residents.
Oh,
So
okay.
it's essentially the attendings, do their cases and they have PAs and they're not doing any of like the free flaps that we're doing.
Right.
And
That's
then,
nice. That's nice.
it's very nice. And then with ENT, they have, from my knowledge, one main head and neck surgeon. She only does the ablations at this point. Like she has the training for the recon, but our team, if we're doing a combined case, our attending is doing the recon.
Yeah, that's actually nice. Like if I did a fellowship and I did all that, I feel like it'd be nice to just do the ablative and get out of there and get home like at 3.
Exactly.
And then like the other team's there till like 11.
Yep.
You know?
I agree.
That would be nice. That would be nice versus like the whole thing. The longest case I've been a part of in residency probably took about 18 hours. I was an intern though. I wasn't the primary, but it just, when you're an intern, you don't want to be the one to scrub out and, you have to do what you got to do,
Exactly.
do your time. But those are long cases, man. What's your favorite thing to do? Do you have a favorite?
I mean, I haven't got to essentially cut much since, I'm just about to go back on service.
What about trachs? You've probably done some trachs in general surgery.
No. So at least in my program, our general surgery essentially is you're at the role of an intern for your 10 months. So it was a lot of just holding the floor pager and essentially just putting out fires,
You go in the ER, doing consults and treat.
So luckily in our program, the intern doesn't have that role. We have they have a 3rd-year resident, essentially, a general surgery, who triages everything surgical and then distributes it to the various teams. So my role essentially was, say, if I was on the trauma service, I would care for the trauma patients while they're already admitted.
On the floors.
On the floors, exactly. Yeah. Or if I was on bariatrics, I would facilitate the bariatric patient's care on the floor. So I didn't really have to do too many consults, which was nice.
Wow, that's nice.
Yeah. But I did get a lot of experience with just managing different situations with patients.
I feel like that experience it's hard to tell people who don't know what that is. Like if you're a dental student, you get into perio or orthodontics or something for your post-grad stuff. It's hard to tell people, like when you see a patient and you've done enough general surgery or even medicine and you see a sick patient and you just lay eyes on them, you give them the eyeball test. I feel like going through that whole experience, you have a really good idea of sometimes how sick people are.
Yes.
Just by talking to them, seeing how they're breathing, just interacting with them. Like, I feel like it really gave me a sense of like, almost like felt like a superpower in a way, like where you just know like something's up. Let's get this lab. Let's do this. I feel like it's hard to, does that make sense?
I tell many people that is like the main thing that I learned is like seeing the spectrum of like who's sick and who's not sick. And like for the most part, the oral surgery patients, they're not sick to where it's like, okay, you're a big time watcher. It can be if, some nasty infections come in.
Right.
But yeah, I agree. You do get that like spider sense of like, okay, I need to get some
it's just the eyeball test. You can kind of tell, like even it really helps me in practice. I remember just, seeing like talking to a patient post-op or something and you're like, you get the sense that there's something else going on here. I need to watch this patient closer or do this and this. And I feel like that really helps that way. But so you're about to start your whole like oral surgery part, it's a long program. 6 years is a big deal. I mean, I didn't take any time off after, college. I went to college, dental school, residency. So by the time I got out, I was like 32, 33. And then I'm like, oh, okay, now I can start working and start paying back some loans and stuff. But so I don't know what situation you're in, but that's kind of how I was thinking,
Yeah, I'm pretty much the same situation. I went straight through. I'll be 32 when I finish.
Yep.
But yeah, it's long, but it's rewarding. I've wanted to do this since I was a kid, and I'm truly blessed to be able to be in this position and getting to do what my childhood dream is.
Yeah. So do you guys do any sedation so far, or does that come later in like your 5th and 6th year?
So it'll come essentially this year now.
Okay.
The year that I'm in, we'll get to do pretty much all of the sedations. While on anesthesia, our Wednesdays, we did like the anesthesia for our like senior residents, just so we can, push the meds, kind of see how the patients are reacting.
Mm-hmm.
So we did a little bit of sedations, but this upcoming year, we'll be able to do the meds and do the procedure at the same time.
What are you guys using? Is it the basics like the, fentanyl, Versed, propofol, ketamine, Precedex?
Pretty much the basics.
Yeah.
Each attending has their preference, but it's cool being able to see what different people like to use, and then eventually I'll be able to figure out what works best for me.
Yeah. Do you guys use Precedex there? Do you know if the attendings use that?
So the oral surgery attendings, I haven't seen any of them use it. When
Yeah.
I was at Franciscan's Children's, like we used that like religiously, and it was really nice. The wake ups were really nice, but I haven't seen any of the OMS attendings doing it.
Yeah. I did it the same way for like 17 years, 16, 17 years, Versed, propofol, fentanyl. And then I probably added ketamine to that maybe like 8 years ago. I started using a
Yeah.
little more ketamine with that. What I've seen in the last, 8, 9 years is when, marijuana is legal in our state, it became legal, people were smoke more. The interactions with it, I see more often, like the tachycardia, people are more anxious, blah, blah, blah. So the IV sedations, I felt have become a little bit more difficult because of that. And like more people use it. And you see a 16-year-old and they come for a consult, in private practice, they come for a consult with their parents and they fill out a health history. And a lot of them aren't going to say they smoke on there or whatever, they're with their parents. And
Yeah.
so like you get a lot of they don't tell you that they do, but they do, and so like that's a lot more than what we see now. And it does
Yes.
interact. I even did an episode with our anesthesiologist on this, on redheads and as well as marijuana and how it interacts with anesthesia, even local anesthesia. It is a thing. I found that Precedex really helps, and I've been messing with it this year, like trying to get the way I want to use it down, because it's weird to learn a new medication. You're doing something for a long time, and all of a sudden there's a new drug, and you're like, how do I use it? How does this person use it? How's this? I'm like asking people like, how do you use it? And so like, I feel like I finally got my system down for how I like to use it. And it really has helped quite a bit with tachycardia, and it's changed the way I do sedations. Like it works differently. It's an alpha agonist, right? So you give it up front and you're going to see a blood pressure drop a little bit, but you're going to see bradycardia a little bit more. So if their heart rate's in the 70s and 80s to start, and you give them like 10 micrograms of Precedex, it'll drop. And so like, you don't want to give it to someone whose heart rate's like you probably have a low heart rate. You're a long distance runner. Like, I don't know, what's your resting heart rate?
I just checked resting heart rate on my Whoop. It's like 51.
Yeah. So you're just chilling at 50s, 40s, whatever. And like, if you're sitting in my chair and I look at the little monitor and you're like at 51 or whatever, I'm like, I can't give you Precedex.
Exactly.
I don't want to drop you in the 30s, man. And so like, there's some people you can't use it on because for that reason, like I don't want to, drop their heart rate below 60 really. And so like, I don't use it on those people, but for most people, they're nervous, they're sitting in the chair, they're definitely above 60. Some people aren't like you, but a lot of people are, and it really helps. In the issue with Precedex, just so just going forward for you, if you have a chance to use it, I give them 2 milligrams of midazolam up front with 10 micrograms of Precedex right up front. I see how their heart rate reacts to the Precedex, and I wait. If it's fine, if it's still where I want it, above 65 or whatever, I'll give them another 5 micrograms of Precedex within a minute or two, like quickly. If their heart rate is still fine, I'll give them another 5 of Precedex. I give about 20 Precedex in about 2 minutes, 2-3 minutes, and with the 2 Versed. And then I let them sit for 5, 10, 15 minutes. It's weird. Like, that's not how I used to do it. Like, you have to wait. It takes a while for the Precedex to kick in, like 15, some people say 20 minutes. And then once it's in, it kind of prompts them to go into a REM sleep. It's weird. It like REM sleep.
Interesting.
It's the most comfortable sleep, right? And so like the deepest level of sleep, it's going to prompt them to get into a REM sleep. So one of my partners gives 20 of Precedex and 2 of Versed, and then like he waits 20 minutes. And they comes in and they're really sleepy. And then you can give them a little, if you want to use your fentanyl and ketamine and propofol on top of that to keep them there. But it's a completely different way and pattern of sedating people that I finally kind of have a handle on now after about 6-7 months of like messing around with the doses and like, how I want to use it. And I feel like I got a good flow with it now, but it's awesome.
Yeah, it sounds it. I'm definitely going to see if any of our attendings would be open to
try it, man. You're in residency. Like if you can do it, it'll help, because I think more and more people are using it on the outside. And just get a flow with it. But if you need any help or any questions, I'm sure you got a lot of resources there, but I'll be happy to help, whatever I can do. But I'm still learning like stuff. It's fun to learn stuff, right?
Exactly.
But yeah, because, IV sedations are going to be like, you gotta do those. And so like, it's a big part of what we do.
Agreed.
On the outside. So when you're done here, are you going to do a fellowship? Or you just private practice? Like, what are you going to do?
Private practice, most likely. Yeah. My brother and I, we ultimately want to work together. We want to start our own practice. And we're trying to navigate, what we're going to do in, the immediate 1-2 year after residency. What we've done so far is at least for Massachusetts, we collected through the board, like all of the oral surgeons who have, an anesthesia license, or we collected all of the dentists who have like our anesthesia license. So making an assumption that they are oral surgeons. And then they have their emails. So we're going to essentially kind of just cold email everyone, be like, hey, we're two brothers. We're looking for work. We understand, you might not be able to give both of us a job, but
Right.
we're just looking for jobs.
Yeah.
So that's kind of what we're going to do, try to figure out what works for us. But ultimately, we want to open up our own practice at some point.
Yeah.
And work together.
That's really cool. That's really cool to see.
Yeah.
Also hit up dental societies, because I think like a lot of local dental societies in your state. You're thinking about Massachusetts, right, Stan?
Most likely.
Yeah,
I think I anticipate us staying here, maybe southern New Hampshire, but this general area.
Yeah, hit up the dental societies, because a lot of them have mailings and emails and pages on social media and stuff, and they'll post stuff about people looking for opportunities. But what's the big one for oral surgery? Career Line or something?
Oh, yeah, I'm not sure.
Yeah, I think it's Career Line. You can,
Okay.
look on there for jobs that are open. They can just send you a bunch of emails all the time of what's open.
Okay.
I get those still. I don't know how to stop them. I still get emails every day from Career Line, job opportunities in Kentucky or whatever, like whatever's new, they'll send me. But yeah, sign up for those emails. You'll get a bunch of those all the time. But yeah, I want to thank you for coming out, man.
Yeah.
This is late for you. You're in East Coast time. I'm in Seattle. It's like 6:40 something here. So you're up. You're on vacation though, right? So,
I'm on vacation. I'm just chilling.
Yeah. So what do you watch? Like, what do you like? Do you watch shows? Like, what do you do? What else besides running and stuff?
Yeah, I'm a huge sports fanatic. So like I watch really everything. Like this time of year, I'm watching essentially the WNBA and baseball, dying for basketball season to come back. In terms of like shows, can't remember the last show I watched. I never actually watched Suits until recently. I just watched
I've never
Suits.
seen it either.
It's really good.
Is it? Everyone
it's
says
worth
that.
the watch.
I didn't even watch Breaking Bad until like 3 months ago.
I didn't watch Breaking Bad either. So.
I just started it 3 months ago and I finished it. I'm like, that was pretty good.
Yeah.
So now I'm watching Better Call Saul or whatever right now. But yeah, and I didn't even see Game of Thrones until like a couple of years ago.
I haven't seen that either.
Yeah, I had COVID and at the time I was quarantined for 5 days and like that's what the rule was. And so I'm like, I might as well start Game of Thrones. And like I started it. I'm like, whoa, it's like, binge the whole thing in like a couple months. But yeah, good for you, man. You gotta get your mind free. The running helps. Totally. Are you one of those weirdos that runs without music or headphones? You just run?
So I'm conscious about it. So with my short runs, I run with music.
Okay.
But then kind of to simulate the marathon, like for my long runs, I won't run with music.
So you can't have music on your marathon?
No, you can, but I don't want to, like, people always say, like, when you're on the long runs in your marathon, like, oh, you're trying to change the song, trying to get into it, but I don't want any of that. I don't want
wasted energy?
Exactly.
Huh.
So on my long runs, I tend to just be out there with nature.
Interesting. Yeah, I would say just tape up your phone or whatever, and so you can't touch it. And just put something on. But yeah, I don't know. I say weirdo just in just trying to be funny because I hate running.
No, totally.
I hate running. I'm like, I can't. I got a rowing machine just because I don't want to run. So I've been using that. But thanks again, man, for coming on.
Problem.
I really appreciate it. So you're gonna go to bed? Or are you like a night owl?
No, I'm gonna stay up for a little bit. I'm on vacation, so I'll probably try to find something to watch.
Do something.
Yeah, that's about it.
What area are you living in Boston?
So I live in the South End.
Okay, yeah.
Do you remember where like Melnia Cass is, Boulevard?
No.
Yeah, it's like off Washington Street. Kind of, it's on the border of South End and Roxbury. Takes me about 5 minutes to get to BMC.
Nice. Is that where you did?
Yeah, I've been in this same spot for pretty much since 2017. It's a good spot. It's pretty quiet. No one really bothers you.
Yeah. All right. Yeah, I lived in Bay Village. It was a neighborhood by Tufts Medical Center. At the time, it was called New England Medical Center, but yeah, Tufts Medical Center. It was like 4 blocks away, at the time, kind of near Chinatown.
Totally.
But that's where I was. It was like 3 blocks from the Wang Center.
Okay. Yeah. I think it's important living close to at least residency.
Yeah, it's just a walk to dental school, so it really helped. So
totally.
All right, man. Enjoy your night.
Thank you. Thank you for having me. We'll chat soon.
All right, later.
Take care.